I am Dr. Jarosław Jóźwiak. I am a psychiatrist, a clinician specializing in ADHD, and for many years I've been working almost exclusively with people with ADHD. In my daily clinical practice, I currently have several thousand patients with ADHD under my care, from children to adolescents and adults, from very different educational and professional backgrounds. What I'm going to talk about today is something I observe every single day in real clinical life. One of the most important questions I hear from patients, parents, and even employers is, are there professions that people with ADHD choose more often? And if yes, what are they? The answer is yes. Very clearly, people with ADHD group into specific professions. But before we go any further, I want to make one important clarification. ADHD does not determine intelligence. ADHD does not limit ambition. ADHD does not force anyone into one career path. What ADHD does influence is how the brain responds to stimulation, how motivation is regulated, how stress is processed, and how attention fluctuates over time. Certain professional environments feed these neurobiological traits better than others, and some environments are objectively more harmful. Clinically, ADHD is associated with a need for novelty and variability, difficulty with sustained monotonous tasks, high responsiveness to immediate feedback, lower tolerance for rigid hierarchies, a tendency to hyperfocus on interesting problems, of course, problems with circadian rhythm and sleep regulation. When you put these traits into the real world of work, very clear patterns emerge. One of the most common professional groups among many adult ADHD patients is IT. Why? First, problem-based work. Each bug, each system failure, each task is a separate problem to solve. The ADHD brain loves this kind of structure. Second, immediate feedback. The code either works or it doesn't. That instant feedback is extremely rewarding for the dopaminergic system. Third reason, hyperfocus. Many people with ADHD can concentrate for hours when the task is intellectually engaging. Fourth reason, flexibility. Remote work, project-based contracts, flexible hours, all of this significantly reduces ADHD-related stress. Importantly, IT is one of the professions where ADHD can become a functional advantage, not a liability. The second large group are artists. Visual artists, musicians, writers, designers, actors, filmmakers. Creativity and ADHD share several neurobiological mechanisms: divergent thinking, rapid association, emotional intensity, sensitivity to stimuli. Many people with ADHD experience emotions more intensely, and art becomes a regulatory tool. However, and this is clinically important, the problem is not in creating, but in finishing projects, meeting deadlines, administrative tasks, financial stability. This is why many creative ADHD patients struggle not with talent, but with structure and emotions. This is why using psychoactive substances is so frequent in this group. They need to regulate their emotional dysregulation, and often not conscious of their base problem, they turn to substances. We know from our studies that the higher emotional dysregulation, the higher risk of developing addictions. The third professional group chosen very frequently by people with ADHD is media. journalism, marketing, radio and television. These environments provide constant novelty, fast information flow, social interaction, short-term deadlines, and adrenaline, which can replace dopamine lacking in ADHD brain. For a person with ADHD, this is extremely stimulating. But clinically, we also see the downside: chronic stress, irregular hours, sleep deprivation, emotional burnout. Many patients, if they can develop some kind of structure, function brilliantly for many years in these professions. Now we come to a profession that is considered very problematic for many people with ADHD: gastronomy. Restaurant staff, chefs, waiters, bartenders. On the surface, it seems ideal. Fast pace, constant stimulation, teamwork, no boredom. But clinically, this is one of the most destructive environments for people with ADHD. Why? Extremely high stress, chaotic multitasking, night work, irregular meals, alcohol and stimulant exposure, severe disruption of circadian rhythm. And we know very well, people with ADHD already have baseline problems with sleep-wake regulation. This combination significantly increases the risk of anxiety disorders, depression, substance use disorders, emotional dysregulation. Many patients only realize the cost after years. Now something that often surprises people. Among my patients, I have a large number of doctors with ADHD. And interestingly, one specialty appears again and again. Do you know which one? It's radiology. Why radiology? Clinically, the reasons are very clear. Each case that a radiologist attends to is a diagnostic mystery, perfect for the ADHD brain. Second reason, no long-term therapeutic management of one patient. Third, minimal paperwork compared to other specialties. Fourth, high level of professional independence. Fifth, possibility of self-employment. These doctors can easily change their workplace. Sixth, working with computers and imaging. And then the seventh, no emotionally charged conflicts with patients. Radiology offers intellectual stimulation without emotional overload. From a psychiatric perspective, it is one of the best fitting medical specialties for ADHD. To sum up, the most important message I want to leave you with is this: people with ADHD do not fail because they lack ability. They fail because they often do not know they have ADHD and they are placed in environments that fight their neurology. When the environment fits, ADHD can be productive, creative, innovative, highly effective. Please comment whether you found these professions surprising. If you found this video helpful, please subscribe to the channel. This is where I try to share evidence-based clinical insights about ADHD.